for anyone out there who's using forearm crutches or Loftstrand crutches, you can see my other video of the underarm crutches. It's the exact same thing for walking, but just in case you come across this one first, I wanted to show how what we call gait training or basic walking with crutches. So for this, like I said in my other video, one of the things that I didn't really realize until I became a patient and started using crutches on a regular basis is that when you put shoes on, you become a bit taller. So all of a sudden my Loftstrands, my forearm crutches, which were perfectly sized for me barefoot or in my socks, suddenly don't fit so well. You can see my elbows are very straight. When I hang my hand, if you saw my other video, you heard that you want that hand grip at the level of your wrists. So you can see suddenly those are a little short for me. So before I do any walking, I'm actually gonna lengthen those just by 1 notch. That's fine. All I find I really need for like a standard height sneaker, it's usually about 1 inch. But see, just by doing that, all of a sudden I've got that nice bend in my elbow. I can push down. The crutch hangs at the level of the handle there. So for walking, my left side is the side I had surgery on. So this is the side I'm trying to decrease weight on. That's really the purpose of crutches, is to help offload. So when you're walking, the most easiest and most safest and most stable way to walk after surgery, or if you're having a lot of pain or discomfort, is what we call a step-2 gait pattern. So when you do a step-2 gait pattern, what you're doing is you're bringing your crutches, you're moving your bad leg, your operated leg, your painful leg, your weak leg, whatever, that leg comes first. Then you're pushing down, straightening those elbows, and bringing your good leg to meet it. So crutches, bad leg, good leg. Crutches, bad leg, good leg. Bad leg, good leg. So this is really a nice way for people to move right after surgery, or if they're really having a lot of pain, just because it's very safe and easy. So that looks good. So though, what I find is that most people, as the pain decreases, as they become more stable, more confident on crutches, they tend to start moving a little bit faster. And this is actually, for as a physical therapist, I really encourage this. I think it's really nice to start getting into a normal walking pattern, unless your surgeon has any precautions. If your surgeon says, I really don't want you letting that hip extend past neutral, you certainly don't want to be doing this. So definitely something to be talking to your surgeon and your physical therapist about. But what people start doing is usually a faster step-through gait pattern. So with a step-through gait pattern, your crutches and your bad leg are coming forward, but then your good leg's coming through the crutches and past. So you can see it's actually a little bit more of a normal walking pattern. And it just takes a little time and coordination to master that. Now with all of these, right now after my surgery, I'm actually allowed to put full weight through my leg. It hurts. I don't put full weight through it generally. But even with this walking, I can do basically 0 weight bearing. I mean, right here, I'm literally like touching the ground. I'm probably putting about 2% of my body weight through. So you can do any of these walking patterns with any weight bearing. The only exception would be if you're non-weight bearing, in which case you really need to keep that foot up. Non-weight bearing is really not common after hip surgery. It actually puts a lot of stress on the hip joint. So usually most surgeons will have you be, having at least a little weight bearing, but there are situations certainly when that happens. In my other video with the underarm crutches, so this will just be a repeat if you saw that one. But one of the other big tricks I have is sometimes after surgery, people have a lot of pain, a lot of swelling, stiffness, kind of fear of movement. Sometimes even they'll have an epidural or some kind of nerve block that actually makes it very hard to move your leg. So a lot of people get just very stuck and are like, I can't even move my leg forward. So one of the tricks that I've done with patients a lot and people seem to really like is that I'll actually have patients put one shoe on. So they put one shoe on their operated side. Sorry, it's dinner time at my house, clearly. But you put a shoe on the good leg, and that way you've just got, and put a sock on the non-operated, or I'm sorry, put a sock on your bad leg or your operated leg. So that way, when you go to step, you can kind of just let this foot slide and you're a little bit higher on that good leg, so you can kind of just move it with very minimal muscle activity. And sometimes patients, even if they can't move this leg at all or feel like they can't move it at all after surgery, they can literally like do like a non-weight bearing, bring that good leg forward, and this other leg can just kind of drag. But having that little extra height on the good side makes it a little bit easier to clear the operated side. So there's some tips for walking with Loftstrand crutches.